The Neurogym Trainer is a unique device designed for regaining motor control and coordination. How often have you asked yourself as the therapist or trainer, I know exactly what I would like to change in my client's movement, but how exactly do I solve the problem of transferring this knowledge of movement into a functional and repeatable execution of that movement? The Neurogym Trainer is the vehicle that turns knowledge of how to move into the automatic skill you desire to teach. It is therefore the ultimate teaching tool that therapists and trainers of movement require to effectively change movement. On the client end, it is all done with fun and the added motivation associated with playing video games. The Neurogym Trainer 1 is especially effective for frequent users of electromyographic or EMG signals. The device doubles as a versatile balance trainer. It is capable of intensive training of muscles in isolation or in combination with other muscle activity which the therapist chooses to encourage or discourage. For example, the therapist trainer could easily train the shoulder to abduct while at the same time discouraging the shoulder shrug, thus promoting a clean activation of the deltoid muscle. While training a single muscle or several muscles, the therapist's chosen training paradigm could, for example, encourage the client to improve the range of amplitude of the movement by attempting to surpass a threshold line. Alternatively, it may encourage the development of coordinated movement through proportionally matching the movement to the control signal. The two channels paradigm is also used for balance training with pressure sensors or for discouraging contralateral or synergistic muscle activity. For example, it could be effectively used to train neck dystonia or the coordination of elbow flexors and extensors. The Neurogym Trainer 1 allows for many versatile paradigms of balance training. Because of utilizing separate pressure sensors, the training individual may focus on side-to-side training, training of stepping, stepping up, or even training with unweighting principle, for example, with the training of bridging, foot lift, or sit to stand. As well, stability training could involve sitting paradigms, such as in teaching an individual to shift weight in a chair sideways or forward. A visit to a Neurogym licensed physiotherapy facility in Hamilton, Ontario demonstrates the above application.
We're right in here. All right, and what's your name?
My name is Gary Gorser. How are you today? I'm playing now. You can't play.
Oh, yeah? So you're playing a game. Okay, your name, sorry.
Lynn.
Lynn, what's Gary doing here?
Gary's working on his weight shift. He's learning to keep his balance. Gary's had a spinal cord injury, so he's trying to regain some trunk control. So what we're doing is we've got some pads underneath his backside, and he's working on shifting his weight from left to right. When he shifts one way, the paddle goes down. When he shifts the other way, the paddle goes up. So it's a fun way to work on his weight shift in an intense manner without it being too repetitious and boring.
This is incredible. How long have you been doing this?
This is about my 4th week now.
Yeah, you're getting pretty good at this.
I beat you.
I bet you could. Yeah, it's funny because, yeah, my butt just kind of lays there, you know.
We're going to let you stand up.
Really?
You're going to do it in standing.
Oh, okay. How do we do that? Or does he have to finish his game first?
No, we can stop the game.
All right, we're stopping the game. And
want me to hold the mic for you?
Oh, okay, sure. Yeah. All right, now what am I
Thanks for
doing?
coming out. What's your name?
Hey, you want to be a game show host now? Yeah. Oh, this is so neat. Okay. Oh, and I'm going to stand on this
Well,
thing.
you're actually not going to stand. You're going to stand in the middle because you've got pretty good balance.
Okay.
So we want to
Well,
challenge
we're not
you.
sure about that.
And we're going to make a little
Oh, thanks,
harder
Gary.
for you.
Okay. Oh, great. Oh, good. A little harder.
Yeah. So we're going to pick up the ball speed.
Pick up the ball speed. Oh, great. You know what? I'm not good at this kind of stuff with my hands. Now I'm going to do it with my feet.
Go a little faster. So
Okay.
So you're going to stand in the middle. You're going to step from one side. So step on the one pad. Okay, and it goes up. And when you step on the other pad, it goes down.
Oh, okay.
And you're going to try and hit the ball.
Okay.
ready?
Watch it. Oh, yeah.
Okay.
Okay.
Here we go.
Oh, geez. Oh, yeah. All right. Oh. No, I'm not doing this very well, am I?
It's challenging. It's a good way to work on balance. So for people who have problems with weight shift. We can also use the machine for, you can see that Gary's got an electrode on his knee there. Because he's got weak muscles, he can also use the game to strengthen his muscles.
Gary, you're the master.
I am.
Is there going to be like a Masters Championship for this?
You're looking at him.
All right, Gary's in. All right, yeah, we have to present him with the cup now, but we're out of time.
The Neurogym Trainer 1 is also capable of playing Windows games, particularly through the proportional control option. In active training of the lower back, for example, the Neurogym Trainer could be used to strengthen and improve the endurance of all trunk muscles in a recommended training posture. The patient may use a pressure sensor to train an effective posterior pelvic tilt, or EMG sensors to train the abdominal or oblique muscles. The Neurogym Trainer 1 allows the therapist to effectively progress the training. For example, a weak or paretic calf muscle may first be trained with a Neurogym ankle trainer, then progress to normal heel raises. The training paradigm may finally progress to hopping. The EMG sensors are especially effective in fine motor training of the extremities. Here, for example, the training individual is involved in intensive training of grasping and opening of the hand and thumb control. The pressure sensors may be helpful in these control paradigms as well. Due to its auditory feedback, the Neurogym Trainer may also be used to effectively train weak or paretic eye muscles, as is demonstrated in this example. The Neurogym 2 is a second-generation Neurogym Trainer that further expands the versatility of training. This device employs various sensors that detect mobility on different levels. In addition to the EMG and pressure sensors, the Neurogym Trainer 2 may include tilt sensor, proximity sensor, rotation sensor, fine pressure sensors, stretch sensor, and joint alarm goniometer. There is even an ankle trainer fitted with 2 potentiometers that could be connected to the device. The control box can receive instantaneous signals from 8 different channels. It may then allow training on each of these sensors or with a combination of the sensors. It thus becomes a high-level movement trainer that allows for training of complex combinations of the elements contained in the desired movement. The Neurogym 2 may be employed for the applications described previously for the Neurogym Trainer 1. In addition, it can help enhance most training paradigms by using extra sensors and by controlling the activity allowed in each. For example, in lifting and in weightlifting, a proximity sensor may be used to detect the vertical movement of the bar. At the same time, a pressure sensor may be used to ensure the proper weight distribution, tilt sensor to ensure the proper mechanics of lifting, and an EMG sensor to ensure the desired activity of the quad or abdominal muscles could be employed separately or simultaneously to facilitate the development of a biomechanically correct lift. The tilt and proximity sensors are magnetized, allowing convenient adherence to metal surfaces. This allows for intensification of regular training with weight training machines. The proximity sensor below the weight stack detects the leg press motion. If so desired, an additional sensor could ensure the desired weight distribution in sitting. A tilt sensor on the arm of a gravitron can be used to effectively train knee flexion and hip flexion through an active assisted paradigm. The Neurogym Enablers, a line of mobility-enhancing devices, are often used in combination with the Neurogym Trainer to enable a more demanding but safe training paradigm. Here, for example, a patient is training to hop with the assist of a bungee walker. A proximity sensor detects the movement and relays it to the software. Another example is that of a client training to shift weight with the assist of a sit-to-stand machine. Here, the detecting sensor may be an alarm goniometer, which is set to disable the video training if the left knee hyperextends. The versatility of the Neurogym Trainer 2 in allowing many, even complex training paradigms is demonstrated here. The client's attempts to cross the left leg behind her right are detected by a proximity sensor.